rate continues to climb. It's now at 5.7% statewide.
State officials announced a plan for vaccine distribution once a treatment is approved by the FDA. Distribution is expected to unfold in phases. Officials say it may take months for everyone who wants a vaccine to get one. They say the initial focus will be on vaccinating those in the most vulnerable populations. Officials say that vaccine will not be required, but that 80% of the state population would need to be immunized to establish what the CDC considers herd immunity. The vaccine will be free for Illinois residents.
Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Good morning.
So on the subject of vaccines, your thoughts on how that gets distributed?
Well, that's a very good question. It's a very challenging problem, but it's totally doable. I know the federal government has actually involved military people because they're very good at mobilizing all the needs for a massive rollout like this. So it's going to be a challenge, but it is going to be doable. But the question is, how long is it going to take and who's going to take it? I think that it's going to take many months.
The CDC has come out and said they've redefined what close contact is. So what is it now?
Right. Yeah, they loosened it up a little bit. Now, a close contact is if you are within 6 feet of somebody for 15 minutes or longer over an entire 24-hour period. That is the official close contact. But please keep in mind, if you don't meet that requirement, but you are close to somebody who's a super spreader or somebody with very high levels of virus in their secretions, even less than that can get you infected.
All right. The positivity rate in Wisconsin is 22.6%. Is that, I know we throw a lot of numbers around, is that compared to the 5% in Illinois? Is that the apples to apples comparison? Wow.
Yes, that's the apples to apples comparison. Wisconsin has spun completely out of control. They put their first patients in that field hospital they built outside of Milwaukee. It just is incredible what's going on in Wisconsin.
They also say that, different people get different effects from COVID, but they say the people with the long-term COVID risks are female, mostly?
No, there may be a slight tendency. So this is what you're referring to is a study from the United Kingdom, where they said after 8 weeks, people that still had symptoms from COVID was about 5%. I think this is a very low, I think it's too low a number. It was the same thing when we said, you lose your smell. At the beginning we said it was like 10 or 15%, but if the doctor actually asks the patient, it goes up to like 80%. So anyhow, so this long haul thing is something that really needs to be studied. I've seen numbers longer than 5%, but it does possibly women over 50 years of age. If you presented with the disease with multiple symptoms, if you had 5 of the symptoms of COVID, those people do worse later on.
I see.
And the other risk factor is asthma and lung disease.
Yeah. All right,
That's just one study.
Yeah. Let's get to viewer questions. Here's the first one. I live in Will County. Why are restaurants the only businesses being shut down due to rising numbers? Nail salons, gyms, massage therapists, and more remain open. This seems unfair.
Okay, it's not really unfair because they've looked at the exposures that known people have had. And restaurants and bars even worse, keep coming up as a risk factor. Now, let's just take the nail salons. If you go in a nail salon, typically now you see the operator with not only a mask, but a shield. They're very careful. They've been trained. The gyms have, there's not that many people that are going to gyms. I mean, the gyms are big as a unit, but as a percentage of the population, it's not that high. But, they've cut back the numbers of people in the gym. So whatever they've mitigated in those other situations has worked to an extent. Whereas the restaurants, when you go in a restaurant, you can't eat with a mask. So you have your mask off. The waiters are supposed to be wearing masks, and the workers in the back, and the delivery people. But the people in the restaurant, you can't wear a mask when you eat, and that increases your risk by 2 to 3-fold.
Here's another question. What safety precautions should we follow when we see our relatives? They are planning to self-isolate for 2 weeks in advance, as are we. When we see them, should we still wear masks and sit 6 feet apart? Is it even possible to have a normal Thanksgiving?
I don't think it's possible to have a normal Thanksgiving. Look at the numbers that we've been talking about today and what you're reading about. You can have a Thanksgiving. You have to be careful. These people sound like they're really trying hard. Quarantining themselves for 2 weeks before Thanksgiving and whatever. It's all about risk reduction. I would think that if you had a small enough group, that if you could stay 6 feet apart for most of the dinner, that would probably be okay.
All right, if you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again tomorrow. Thank you, Doctor.
Thank you.
Hey, have a good day.
Let's get a check of the weather now. Morgan, you back with